as we continue to work with all the provincial laboratories very closely, my understanding is that the capacity is beyond the 60,000. Now, there may be other reasons why lineups occur in different spots. Maybe the lineups don't occur in certain localities, but longer in others. So that's somewhat sort of on the ground programming or logistics. I understand that Alberta, for example, made a massive effort over the past weekend to get through some backlogs. So I think they're working really hard to try and figure this out. Some of it might be human resource, for instance. What the federal government is doing, and our National Microbiology Lab is also looking at how we can recruit other federal government laboratories to enhance that capacity as well. So that is generally right now the PCR platform, which needs, a swab at the back of your nose in general, and then sending it to a lab. There's a lot of interest, including in the public health sector, for the more easy-to-use rapid tests, which I do think, I totally agree with, a number of the comments and the experts, and that we need to augment the portfolio of testing capabilities in Canada. Obviously, it depends on where you are in the country, but the key priority for testing is if you have symptoms, and they can be mild, because as we all know that COVID-19 can have a range of symptoms, and often they are quite mild. So those are the people that should get tested as a recommendation. For people who have no symptoms, in general, those are the contacts of cases, or you're part of an outbreak. That's how we would recommend. You think you've been exposed, or you had your COVID alert app and someone says, oh, you've been next to someone who might, who is a case. So those are the key people. You're a potential contact. You have an exposure risk.